Hi everyone, welcome to the video on gross motor and fine motor development. As you may be familiar, child development comprises the following domains: gross motor, fine motor and vision, hearing and language, and social-emotional. When assessing a child's development, it is important to appreciate that there is a wide variation in typical development. Also, new skills develop in bursts and pauses rather than linearly. Hence, one should appreciate the ongoing process instead of focusing on a rigid timetable of milestones. For children who were born preterm, below 37 weeks gestation, correction of prematurity should be made until the age of 2 years. In this lesson, we will explore what is typical motor development in children and some examples of developmental variants. This is a very busy slide summarizing the major developmental milestones and red flags from birth till 5 years of age. I will elaborate on some important points for each developmental domain in the following slides. To understand gross motor development, I will discuss the three main processes that enable the infant to go from a predominantly flexed newborn position to an upright mobile state. Firstly, the infant's tone becomes less flexed, such that by 6 months of age, the legs can be extended for the toes to reach the mouth. Secondly, primitive reflexes also become diminished and give way to voluntary movement. For example, when a newborn's head is turned to one side, the fencing posture appears due to the asymmetric tonic neck reflex. As this reflex disappears, the child is able to bring the hands to midline. I will touch more on the primitive reflexes in the next slide. Thirdly, the child also needs to learn to develop balance to keep the child from falling when walking. The parachute response of a 9-month-old involves the extension of arms and legs to catch themselves when dropped to the ground. Infants learn to maintain new positions weeks to months before they can attain them voluntarily. For example, a 6-month-old can stay seated briefly if placed in the position, but cannot get to that position themselves. Most cannot walk independently until 4 to 5 months after they pull to stand. Primitive reflexes appear and disappear at specific times. Suspect dysfunction if they are absent or persist beyond the times stated on this slide. There are many primitive reflexes. I will focus on the following reflexes, which are important to help one understand typical motor development. Palmar grasp reflex is elicited by placing a finger in the open palm. This reflex needs to be lost before the child is able to have voluntary grasp of objects. Moro reflex is elicited by supporting the infant's back with the infant in a semi-erect position and allowing the infant's head to fall backwards onto the examiner's hand. A normal response is when there is symmetric extension and abduction of the upper extremities, followed by symmetric flexion and a cry. Asymmetric tonic neck reflex is elicited by turning the infant's head to one side. The child will go into a fencing position such that the ipsilateral arm is extended while the contralateral arm is flexed. The infant needs to lose this reflex by 6 to 7 months old so that the infant can voluntarily turn the head, use the arms across the midline. The parachute reflex develops at 9 to 11 months. It is elicited by holding the infant's trunk with the infant facing the ground, then suddenly lowering the infant towards the ground. The infant's arms will spontaneously extend to break the fall. This needs to develop before walking. Apart from the variation in timing of achievement of milestones, the quality of motor milestones may also differ among children. Let's take crawling as an example. Some babies may crawl at 9 months. Some may never crawl and go from sitting to standing and walking. Others may have a variant of crawling, such as commando crawl, crab crawl, bear walking. These are all normal. Investigate if there is a delayed milestone with other features, for example, global delays, abnormal posturing, persistent fisting. Some babies may bottom shuffle instead of crawling. These babies may not have tolerated much tummy time. They have low motivation to stand or crawl, as they can move fast via bottom shuffling. Hence, they may be late in walking. At this point, you may ask, why do some children walk faster than others? Does it mean anything? The temperament of a child may affect his gross motor development. Temperamentally inactive children who adapt slowly may not attempt independent walking until long after they are neurologically able to do so. Very active infants may start taking steps as soon as they can stand. They may also rarely walk if they can run. There is no correlation between intelligence and age of gross motor skill acquisition. There is also no single motor skill that can be used as an indicator of neurological integrity. We will now move on to the development of visual milestones. Visual development is integral to the development of fine motor skills. Hence, one must understand the visual milestones first before we move on to discussing fine motor milestones. As with the rest of development, a child's vision develops over time. It is not fully clear like adult vision until the child is a few years old. Be aware of what the child is likely to be able to see before engaging with the child. As discussed, the loss of the primitive palmar reflex at 2 to 3 months allows for voluntary grasp to develop. The hands become unfisted, and by 3 months, the child is able to hold an object placed in the hand. The child can also swipe at objects in front of the shoulder. At 6 months, the child is able to reach for objects at the midline. And at 7 months, the child can transfer objects from one hand to the other. A 9-month-old child would have developed an inferior pincer grasp, which becomes mature at 12 months old. At 1 year old, the child can orient the hand in an appropriate plane, bang 2 blocks, cast and make marks on paper using crayon. Parents may not be able to give a history of the child's skills with blocks or writing materials, as these may not be part of the child's play repertoire at home. For the same reason, it is easier for fine motor delay to go unnoticed compared to gross motor or language delay. Understanding the expected fine motor skills of the child will allow one to give the child tasks that are developmentally appropriate. Let's now discuss some red flags. When development does not proceed in the typical way we expect it to, there are 3 patterns of anomaly. Firstly, developmental deviancy refers to achieving milestones out of typical order. For example, if a child rolls and crawls but does not sit, this could be secondary to underlying spastic diplegia and should be evaluated. If a child grasps with the left hand but remains fisted on the right, suspect right hemiplegia. Secondly, developmental dissociation refers to a different pattern of development in various areas. In children with cerebral palsy, they may have delayed motor skills but better skills in language. Conversely, in children with autism or intellectual disability, the language skills could be more delayed compared to motor skills. Thirdly, developmental regression refers to plateauing or losing skills. This is never normal and should always be referred to a developmental and behavioral pediatrician for further evaluation. Developmental delay refers to development that is delayed compared to the expected milestones at that age. Global developmental delay is defined by delay in 2 or more domains. This is fairly common, with an estimated prevalence of 1 to 3% of population. Before we end the video, let's recap. Typical motor development follows a sequence. Be aware that there are developmental variants. If in doubt, refer on to a pediatrician or developmental and behavioral pediatrician for further evaluation.